I'm James Taylor, and you're listening to the Super Creativity Podcast, a show dedicated to inspiring creative minds like yours. What could a lace maker have in common with vascular surgeons? A Savile Row tailor with molecular scientists? A fighter pilot with jazz musicians? At first glance, very little. But Professor Roger Kneebone, who has been called the expert on experts, has spent a lifetime finding the connections and recently published these in a new book called Expert: Understanding the Path to Mastery. In Expert, he combines his own experience as a doctor with insights from extraordinary people, cutting-edge research to map out the path we are all following, from doing time as an apprentice to developing your voice and taking on responsibility as a journeyman, to finally becoming a master and passing on your skills. As Kneebone shows, although each outcome is different, the journey is always the same. Professor Kneebone directs the Imperial College Centre for Engagement and Simulation Science and the Royal College of Music Imperial College Centre for Performance Science. His first career was as a surgeon operating on trauma patients in southern Africa. He then changed direction, becoming a general practitioner in southwest England. Now, as an academic at Imperial College London, he researches what experts from different fields can learn from one another. His unorthodox and creative team includes clinicians, computer scientists, musicians, magicians, potters, puppeteers, tailors, and fighter pilots. Expert is his first book for a general readership. Whether you're developing a new career, studying a language, learning a musical instrument, or simply becoming the person you want to be, Professor Kneebone's groundbreaking research and book reveals the path to mastery. Roger and I discuss how anyone can become an expert, the future of work, improvisation skills, thread management, innovation, ZPD theory, and why having expertise and being an expert aren't necessarily the same thing. So, Professor Roger Kneebone, thank you so much for coming and joining us today. You've been called the expert on experts. So how do you feel about that term? And in this time that we're living through just now, kind of experts felt like they went out of fashion, but they seem to be coming back into fashion at the moment.
Yes. Well, first of all, thank you for inviting me onto the program. I do feel very uncomfortable at this idea of being called an expert about anything really, and I suppose that brings into question the whole idea of what it means to be expert, which is what this book is all about. I think experts have had a kind of a bad press recently, and there's been a sort of movement of almost mistrust or sort of feeling that experts aren't really necessary, which I think is very dangerous. And one of the things I've tried to explore in my book is what it means to be expert and why I think experts are so important. And I mean, one of the reasons is an obvious one, I suppose, which is that we all need experts for the things that we need to have done that we can't do ourselves. And it might be if we need an operation, we need an expert surgeon to do it. If we need to fly somewhere in the days when we used to fly to places, and I'm sure we will again once the current pandemic has changed. But we need expert pilots to fly us around when our central heating system blows up or something. We need expert people who can help us with things that we can't do. And these days, particularly, I think we need experts to help us navigate these very uncertain times that we're in with the pandemic and all the other things that are going on around us at the moment. But there's another reason we need to understand what being expert means, I think, and that is that we are all of us, I think, somewhere on a path towards becoming expert. And we may not be terribly far along it if we've only just started, for instance, I don't know, learning a new language or taking up a hobby or a sport or something like that. We may be right at the early stages, and in other parts of our lives we might be much further on in our profession or our job or whatever it might be. But we are always somewhere on a pathway that leads to becoming more expert. And we can talk in a minute about what those what
And
the
in the
aspects of those.
book, I mean, you make it's interesting because you're, in some ways, I feel you're a natural categorizer. You're very good at being able to like take us through in a very logical way, and that's obviously your teaching background as well. But one of the things you say in the book is you can have just having expertise doesn't necessarily make you an expert. Is that correct?
Exactly. So I think this is an important distinction to make because people talk a lot about expertise, but to me the central thing is that people who have become expert, they do have knowledge and skills and particular aspects of their work, let's say, that you could consider as instances of expertise. But there's something more than that. By going through that going along that pathway that's taken them a very long time, they've encountered experiences. They've got things wrong. They've had to put them right. They've had to deal with all sorts of things, which have led to them accumulating wisdom. And I think it's this word wisdom that really, to me, captures what becoming expert is all about, because it isn't just about the things that you can do with your hands or the facts you know or the or isolated elements. It's how you put it all together and you make sense of that world that you've chosen to spend a lot of time developing in. And in those later stages, I think you also start to have a wider sense of what that area that you've spent a lot of time in is about, and how you can encourage other people who are also interested in pursuing the same line. And so there's something about becoming expert that a purely descriptive account of stages doesn't really capture, because what's important, I think, is the inside story of what goes on inside somebody. It's essentially it's a human process. It's not a collection of things that you can abstract and say here are components of expertise. It's an integrated thing that happens to people as they develop.
Now, on that wisdom, you mentioned in the book, your background is in surgery, and so one of the things I liked about the book is you have these stories from tailors, from surgeons, from musicians, from magicians. And one of the things I think you mentioned in the book was, for example, a surgeon where at different stages in their career as a surgeon, their expertise, that path, they kind of get to know what they need to do, all the parts of the body and what things look like, and get accustomed. And then they kind of move to a stage of deciding, when is appropriate to use certain things. And as they get further along the journey, they get to discover when not to use, when to have the skills, and when to pull back, and when to say actually. And one of the things you mentioned really nicely, which was about airline pilots, was this idea of just kind of sitting on your hands.
Sometimes that's really interesting, and I thought about this a lot because in the book, as you say, I bring together stories of many different kinds of experts, but I also wanted to get at the kind of the sort of inner feelings of some of those parts of the pathway. And so I drew on my own experience. And at one stage, I trained as a surgeon. I did a lot of trauma surgery, particularly in Africa, so dealing with people who'd been stabbed and shot and blown up and things like that. And so I was having to put together a whole lot of factual knowledge and a whole lot of skills of doing procedures and parts of operations and that sort of thing. I was having to put that together, but then I became more and more aware of the need to make sensible judgments about whether to do things at all or in what way to do them. And also having the resources, if you like, to recognise when things were going not awry exactly, although sometimes they were, but recognising when they were going off my expected path. And I think when you're just becoming, when you're starting to learn how to do something, there's a tendency to want to react quickly if things go wrong. And in my case, in surgery, one of the things that often happened with people who'd been stabbed is that you'd open somebody's tummy up, for example, and it would look fine, but then you'd just dislodge a clot of blood, say, and all of a sudden, whoosh, there'd be a lot of bleeding, and that can be rather frightening. And it's very tempting to sort of take a clip, an instrument, and try and put it on what you think is the blood vessel that's bleeding, and stop it. But actually, if you do that too impulsively without being absolutely sure that you're putting it on the right thing, you can actually cause damage. So I learnt through experience, really, that the best thing to do was to use a sort of temporizing measure, which in my case was putting a large swab on it and pressing very hard, which would stop bleeding while I was pressing on the swab. When I took the swab away, the bleeding would come back again. But it meant that I could sort of control things and control myself while I gathered my thoughts and decided what to do next. And it turned out, with a lot of the other experts that I've talked to over the years, that they have something similar. They often call it a place of safety, that they've thought through in advance, so that they can go to it in a sort of instinctive reflex way before even trying to think through why they've needed to go there in the first place, if that makes sense. And a really interesting example was from a fighter pilot I've been working with, who gave an example of when he was coming down to land, which he'd done thousands and thousands of times, and gone through the landing checklist where you know, flaps down, undercarriage down, this, that and the other, radio that you're coming in, all those things, and he'd done all those things. But just as he was coming down to land, he kind of got a feeling that something wasn't right. And he didn't have, he only had a fraction of a second to respond. And the way he responded was instinctively he put on full power and climbed. So instead of landing, he climbed up to a safe altitude. And once he'd got there, he started going round in a square, and then thought through what had happened. And what had happened was that he had gone through his pre-landing checklist, said all the things, but he actually hadn't done the one that lowered the undercarriage. So although he'd said undercarriage down on his checklist, he hadn't actually pressed a button that had done it. And so if he'd done it, of course, he would have crashed. And the interesting thing about that to me was that he had decided in advance how to get to a place of safety when he recognised that something wasn't right, rather than spending time at that moment trying to work out what wasn't right. And lots of people I've spoken to, from polar explorers to performing magicians to musicians to all sorts of people, have got this sense of how you can get back to something that allows you to, as you said earlier, sit on your hands and count to 10, or just gather your thoughts before committing yourself to something irrevocable that you might end up regretting. And I think that's a characteristic of having been through enough experiences and done enough stuff to realise, to distinguish, and to trust that feeling that something isn't right, and you need to press pause while you collect your thoughts, rather than suddenly leaping into action. Do you think that makes sense?
Yeah, and as you're talking about, you mentioned like the idea of the checklist, where you thought you could gone through all the checklist, but there was this other thing. As you take us through this path to mastery in the book, you take us through that a more classic, the person that's just starting, so the apprentice, then the journeyman, and then the kind of master. Although it's obviously not quite in a linear way, but kind of these just as our almost like 3 acts, I guess, as you take us through. In that first one, the apprentice, one of the things that you mentioned there, which I guess is kind of what you talked about, the checklist, and is kind of paying your dues, of kind of, you talk about doing the work, putting in the hours. I wonder, because you work with a lot of younger students now as well at various universities. I wonder, is that becoming almost something that is to a lot of maybe younger generations trying to avoid? Yes, putting in that more routine, boring perhaps work. Is that a problem? Is that always required in that apprentice stage to get on that road?
Yeah, I think it is becoming a problem. In my book, I've called that stage doing time. And it's an interesting stage because this idea of a 3-stage thing, 3 acts as you put it, and I've used the terminology that's been around for hundreds of years: apprentice, journeyman, and master. Not, of course, now in any gendered sense, but to give a sense of transition and development. But that early stage, traditionally, was when you spent years and years and years in your master's workshop, and you were learning to be a stone carver, or you were learning to be a leather tanner, or whatever it was. And it took a very long time, and you started off really having no idea at all of what you had to do or what the thing was about, but you just had to do what you were told, and it was often very repetitive and very boring. And at the time, it's very easy to think, well, why couldn't somebody else do that? Why do I have to do that? This is really, it's pig boring, and why am I doing it? And I mean, I certainly went through that stage when I was sort of hanging on to retractors, instruments to hold things out of the way during operations, so that somebody on the other side of the table who could get a good view could see what they were doing, and I couldn't have any view, and I just spent hours crunched up holding these things, wondering why it couldn't be done by a machine or by somebody else. But actually, when you look back over it, you find that all those years are very important, partly because they allow you to embed those techniques, which, as a more experienced person, you absolutely need to know how to be able to do. You have got to be able to make flat stone surfaces, or learn how to tan a hide, or whatever it is you're working to. But also, it gives you an understanding of the world that you're in, of the materials that you're working with, and the tools and things like that. But also, crucially, it gives you an experience of learning to cope with boring, repetitive work of no apparent value at the time. And I think the feeling that people often have now, which is that they are almost entitled not to be bored, is it's very unhelpful, because in anything that you're not good at yet, but you want to get good at, and that is worth the effort of spending years doing it, there is going to be boring work, and there's no way around it. And unless you can find a way of coping with that, you will, I think, be perpetually uncomfortable or restless. And one of the people who was most influential when I was writing this book was a bespoke tailor called Joshua Byrne, who really clarified this for me. He'd been at university studying economics. He'd decided halfway through his course that actually that wasn't what he wanted to do, and he wanted to become a tailor. So, to cut a long story short, he started an apprenticeship, a long apprenticeship, as a jacket maker. And when he started doing that, he said that at university it was quite straightforward. You'd learn a concept, it might be difficult, but you'd grasp it, and then you'd move on to the next one, and you'd build on the last one, and then you'd go on. And it was quite difficult to understand very often, but once you'd got it. When he became a jacket maker, he could understand pretty much from the beginning what it was about and what he had to do. But it took him years before he could actually do it. And because it was all about doing physical things with your hands and learning to sew and things, and the speed at which he understood the nature of the task, and the speed at which his body allowed him to become skilled at doing it, were completely different. And he said that he went through that stage of finding it boring and repetitive, but he realised that he had a choice. I mean, he'd committed to wanting to be a tailor, and either he could forget about that and go and do something he found more interesting, or he could stick with it and find a way of making what he had to do interesting. And I thought that was really interesting, because he's talking about having agency to reframe what he had to do anyway, and see it as an opportunity to develop his skills, or to become more familiar with the textiles, or whatever it was, but to find something in it that caught his interest. And I think that to go back to your point about whether students these days have a lower tolerance for doing boring work, I think they do, and I think it's a sort of, it's something in our culture more widely that there is a sort of intolerance of boredom and tedium, which really gets in the way of these processes, these slow burning, gradual processes of embedding in your body ways of doing that just take a long time to get good at.
And it's funny because not to be generalist as well, because I know younger generations often get criticized, or millennials get criticized for having shorter attention spans than maybe previous generations. But I always think like watching like a Netflix series, and you think, people might have gone and watched King Lear 3 hours, and that required a certain level of attention span. But some of these TV episodes on Netflix, they last for weeks and months. And I thought, well, actually, maybe it's not necessarily the lack of attention, maybe the boredom factor is a more crucial one. You mentioned the tailor there. Another part which is of this apprentice and is quite it kind of defines part of this apprentice is talking about the role of space and the physical environment in which they're working and how they're interacting with other people. And you talk about the tailor, the mise en place, understanding the environment. One of the things you mentioned with that progress of that tailor going from apprentice upwards, even in that apprentice stage, and something I didn't realize was that tailor, there's the 3 different stages, and they will go and spend different times learning these different stages. And some of the stages require a very set type of skills, but as time goes on, it's maybe a different set of skills. And so you mentioned this idea of having that combination between the social and the technical skills, which not every tailor is necessarily required to have, depending on the type of tailoring they're doing.
Yeah, so I discovered this when I started working with Joshua. I hadn't realised that there were. Well, I knew nothing about tailoring, particularly bespoke tailoring, and there are 2 kinds of tailors. There are making tailors who construct jackets and trousers and things like that, highly skilled, and all those many layers of a garment and things, and it takes them many years to learn how to do it. And then there is a different kind of tailor who are called cutting tailors, and those are the tailors who interact with customers. So the making tailors work out of view, and they never see the customer at all. Whereas cutting tailors are the ones who meet clients, and then they have a conversation with them about what sort of clothes they want, and then they'll choose the cloth. They will actually cut out a pattern, but that's only just a part of what they do. And then having done that, they send the cut cloth to the making tailor with instructions, and the making tailor then comes up with a sort of provisional interim garment, and then the cutting tailor tries that on, or the customer tries that on, and the process is repeated in a series of fittings. And this is a very interesting distinction, I think, because most tailors are either a cutting tailor or a making tailor. Joshua, my colleague, was very unusual in that he did an apprenticeship in both. He did 2 apprenticeships, one after the other. But they require different kinds of skills, because the cutting tailors have to be acutely aware of the person they're with, and that's really when it struck home to me what strong parallels there were with my own experience in the world of medicine, because my first phase of my career was, as I said, as a surgeon, and a lot of that, not all of it of course, but a lot of the focus there was on doing dexterous things and cutting out things or sewing them or putting them together. And I thought at first that that's where the parallels would be with tailoring, but actually I discovered, talking to Joshua, that the relationship that he develops with his customers as a cutting tailor are very much like the experience I had in my next phase, which was as a GP, as a family doctor, which I did for almost 20 years. Because the task there for the tailor is to try and get a sense of the person they're with and what they want a garment to do and how it fits into their life and what it's going to make them feel like. And then they have to make judgments. The tailor has to make a judgment about what a person looks like, what they want to look like, and what it may be possible through tailoring to make them look like. And that's a question of often balancing different perspectives, different wishes. And it made me think that the essence of what I was seeing with Joshua was not really the suit or the jacket. That was the visible manifestation of a relationship of trust and care, based on integrity and a sense that it was the customer's best interest that was at the centre, and that making the jacket or the suit was an expression of that relationship in a sense, and that customer might never have anything else made, or they might have loads of other things made, and those would be other sort of outcomes from that relationship. And it made me think that as a GP, I might see somebody with a particular disease and give them some treatment, and it might work fine. But actually, underpinning that was that relationship of trust and care between one person and another person, where their two worlds of experience intersected to come up with some solution to a problem, whether the problem was, or the challenge was coming up with a jacket that fitted and worked and was just right, or whether it was how to deal with asthma or diabetes or blood pressure problems or something like that. And that actually the primary thing was a human relationship. And I thought that was fascinating, because I'd never really thought that there would be that point of connection between tailoring and medicine, because they seem so very different.
It's interesting, even, and you're talking about GP. I've got a friend that's a neighbor that's a GP, and some of those, when you meet with a patient and they come in and present with one lot of things, and then you ask as time goes on, and is there anything else? And that often throws up a whole bunch of other things, which are not necessarily physical manifestations, but there's other things kind of going on as well. So you mentioned about the tailoring book. It was interesting because as I was reading Expert, I was also reading another book. I always like to mix fiction and nonfiction. So you are my nonfiction book of the week, and my fiction book of the week was actually The Tailor of Panama, John le Carre. And it was very interesting kind of reading those two things together. And you actually mentioned in the book enjoying le Carre, and I was astounded to realize this is your first book, solo authored book as well. So I guess this kind of moves us on to the second act, going from apprentice to journeyman. And one of the things there was about developing voice. So maybe you can talk, I know you've mentioned lots of stories in the book. You had a beautiful Bill Evans story about how he developed his voice as a musician. How did you go about developing your voice as an author and moving from that apprentice to more of a journeyman and as a writer?
Yes, that's an interesting one. I mean, you talk about le Carre, and I think he's a very interesting example of somebody whose voice has become more and more, I don't know quite how to express it, but more and more powerful as his books have gone on. And I think he's an example of somebody who has really, or a while ago, reached that stage of being of such mastery that the way in which he writes is it's so expert that it's almost invisible. It's just
I'd be reading in bed, and every so often I would have to I'd turn to my wife and say, listen to this line, listen to how beautifully crafted this sentence or this paragraph.
I've just read his latest one before he died, which was Agent Running in the Field. Have you read that?
Yes, I have. I did read that. Yeah,
absolutely spectacular, and it immediately pulls you into the world of another person and is utterly convincing. And I think that seems so effortless that mastery conceals decades of going through those stages. I mean, his early books are not the same as his later books, and I think you can see in his trajectory that a whole lot of stuff becomes almost invisible because it's so skillfully woven in.
But even one of the perfect example for you in terms of, like, can really understand how you developed that voice, because I know you've probably written for many more academic things as a doctor, but in terms of writing a book like this, each chapter or many of the chapters used a device of starting with a opening story, usually often related to you and your journey as a doctor, as a GP. And you were, I guess, in storytelling, opening a loop, but you wouldn't close that loop until the end of that chapter. So it created a little bit of tension in each chapter. And then during the course of the chapter, you're telling other people's stories. And then you close out the chapter with closing that loop, with the completion of that story. And it's like tension and release. So that's not the work of an apprentice doing that. That's more someone that has become skilled in writing. So how did you develop that? How did you find that? How did you develop that voice?
Well, thank you. I'm glad it came across to you like that. So it's true. I had done quite a lot of writing along the way, mostly for journals and things. And so that's or the occasional chapter for textbooks, completely different type of writing. But I'd written a number of quite short pieces for medical journals. There's one called The Lancet, for instance, which I'd contributed a number of articles which I felt did need to have a clear arc. They were more conceptual essays. They weren't scientific journal articles within a constrained traditional format, which scientific articles usually require, with a structured abstract, and you start with an introduction, and then you present data, and then you analyze it, then you discuss it, and then you finish. Not like that, but more sort of essays that needed to have a narrative arc. And so I've been thinking about that, how in 700 or 1400 words I could tell a story with a point. And then I had to think about how to try and achieve that in a much bigger form in a book. It's got about 350 pages, I think, something like that, over 8 or 9 chapters. So I had ideas about that, but I was very fortunate in being able to work with an editor, Jack Ram, who first of all was part of the he was at Penguin when I first encountered him, and he was one of the people who invited me to put forward a proposal for this book in the first place, and we started working together. He then left Penguin and became independent, and so we carried on with that relationship, which I think was a bit like the one I described between Joshua and his clients, or perhaps between me and my patients, which was a collaboration between people with equally valid but different kinds of expert ways of thinking. And his skill as an editor was quite different. He wasn't a co-author or anything, but he brought a different way of looking at what I was doing from the one that I was developing as the person who was writing it.
Yeah.
And so from time to time we would both look at what I'd written and bring our different perspectives together. And he was very good at seeing the shape of something even when the writing itself wasn't finished, if that makes sense.
You could get there was a feel, or you mentioned like feel earlier on as well.
And a feel for the balance between the elements and the threads within each chapter and the threads across the whole book. And I suppose in a way it made me think a bit like the difference in perspective between an orchestral, I mean, I'm not an orchestral musician, but how I imagine that would be if you're playing the trumpet or the violin, as opposed to the conductor who has a sort of overall view of the whole thing as it's emerging. And that was it was a very creative partnership. I don't think all authors by any means have the privilege or the opportunity to do that. And we hit it off very well. But I saw it as a sort of conjunction of different kinds of expertise in a way.
Yeah.
And he didn't know anything about the content, and I didn't. Well, I mean, he didn't know anything. He had a different way of thinking about the content, but he knew a great deal, had a lot of experience of working with other authors on other books, of course, which I didn't have. And so those two perspectives came together in my case in what was a very creative relationship.
No, I mean the book's wonderful. It's really beautifully structured and thoughtful, and as you kind of come up to the end of the journeyman section of the book, the middle act, I guess, of the book, you talk about learning to improvise. This is like as you start bridging the Rubicon, like making that transition from journeyman, I guess, and onto master as well. And you told a great story. I mean, you told about Keith Jarrett, which I'd never heard before, which I thought was a fantastic story. I'm James Taylor, business creativity and innovation keynote speaker, and this is the Super Creativity Podcast. If you enjoy listening to conversations with creative thinkers, innovators, entrepreneurs, artists, authors, educators, and performers, then you've come to the right place. Each week, we discuss their ideas, their life, their work, successes, failures, creative process, and much, much more. You'll find show notes for today's episode, as well as free creativity training at jamestaylor.me. If you enjoy learning about Roger Kneebone, the path to mastery and innovations in science, then check out my interview with technology futurist, geopolitical expert, and senior fellow of the Atlantic Council, Jamie Metzl, where we discuss genetic engineering and the future of humanity. Hear my conversation with Jamie Metzl at jamestaylor.me. After the break, we return to my interview with Roger Kneebone and why understanding the difference between maps and guides can help us achieve mastery in our chosen field. This week's episode is sponsored by Speakers U, the online community for international speakers. Speakers U helps you grow, launch, and monetize your speaking business faster than you thought possible. If you want to share your message as a highly paid speaker, then Speakers U will teach you how. Just go to speakersu.com to access their free speaker business training. You also told a story which I thought was interesting. You said like a jazz band is like a surgical team. They're kind of supporting each other and working with each other. You tell a story about a Portuguese pianist. There's something very, I'd love for you to tell that story just now. I actually went and looked at the video afterwards because the video exists, and I was amazed this happened. So please tell the story, because I think it builds upon what you were talking about throughout the book in terms of paying your dues, getting those hours, doing those hours, and then you start to move in this improvisation. And we're talking about classical music here, so it's not
jazz music.
Improvisation
in the sense of improvising notes. So this is a story that happened quite a long time ago now. A very famous pianist called Maria, I never know quite how to pronounce it, João Pires, anyway, a Portuguese pianist, concert pianist, who was giving I think it was a lunchtime concert in the Concertgebouw, I think, in a very famous concert hall with an orchestra conducted by Ricardo Chailly, equally famous conductor, and she was playing a Mozart piano concerto. So you see her sitting down at the piano, and Chailly sort of starts, and on the opening bar of the orchestral introduction to this Mozart piano concerto, she realizes that it's not the one she prepared. It's not the one she was expecting to play. And you see this look of horror on her face when she suddenly realizes that, she's got a couple of minutes or something before she's supposed to start, and it's the wrong one. And you see her sort of look sort of panic-stricken, really. And Ricardo Chailly, he sort of looks over, he carries on waving his baton, conducting the orchestra. He says, "Don't worry, I know you know this other one, and I know you'll be fine. You've played it before, it'll be fine." And you see her, and she sort of sits there, and she composes herself, and she shuts her eyes for a moment or two, and then she opens them again. And then the moment comes for her to start, and she plays, and she gives a flawless performance of that Mozart piano concerto that she wasn't expecting to have to play. Now, of course, she could only do that because she knew that piano concerto and had played it many times before. But remember that she's playing from memory, and she's playing in the moment, in front of a large public audience, out there, sort of on the platform with nowhere to go. And I thought that was just a completely extraordinary thing to be able to do, because she was not only able to draw on that sort of knowledge of the work and the repertoire and the fingering, and actually being able to remember the notes and play them, but she was able to do it at 2 minutes' notice or less, under conditions of quite extraordinary pressure, and not only sort of struggled through it, but actually gave a magnificent performance where nobody would have known that there was anything unexpected about it. And to me, that's what improvisation is about. Not, as I say, not improvising new notes or anything in that case, but being able to read and respond to an unexpected situation, and draw at very short notice on a whole lot of stuff that was only inside you because you'd spent years and years and years going through those stages.
And in the book as well, you then also kind of relate that to a story of you doing a surgery on a young gentleman, comes in serious neck wound, and very high stakes kind of situation, and you had to improvise. You did something using a a device which is not normally used in this type of kind of trauma surgery.
I've never forgotten this one. It was very scary. It was somebody who'd been stabbed in the neck, and that's not easy to deal with anyway, because there's such a lot of important structures in the neck. But this young man had blood sort of welling up, and I thought I'd found where the blood was coming from and dealt with that. But it turned out that there was more blood coming from right at the back, and it turned out that there was the knife wound had found its way through into the space between two of the vertebrae. I don't want to give listeners the creeps, but the vertebrae in the neck, the bones of the spine, sort of, if you line them up, there's a channel down each side which a very important artery goes up in, called the vertebral artery. But because it's in a bony channel, it's extremely difficult to get at. The knife, unfortunately, had got at it, and so blood was spurting out of a place that was extremely difficult to get to. And I really didn't know what to do, but I didn't have time to I mean, there wasn't anybody else around, and they couldn't get there in time to help me anyway, so I had to do something. And I distinctly remember reading or hearing somewhere about somebody who'd had something a bit like that themselves, and they'd used a little tiny catheter of the sort that's normally used to go into small children when they've got problems with their bladder. So it goes in through the urethra into the bladder, and then you blow up a little balloon at the end so it doesn't fall out again. And so I asked the theatre sister to give me one of those. She thought I'd gone completely loopy. You would never normally ask for a paediatric urinary catheter when you were dealing with a grown man's neck. But she got it for me, and we were able to feed it down into that bony channel and then blow up the balloon, which then put enough pressure on the artery to stop the patient bleeding to death. While, in other words, a bit like the fighter pilot putting on power and getting to a safe altitude, it gave time to stabilize the situation and think about it. But that was an example, I think, of being able to sort of reach out and capture something that I didn't even know I knew about. And it might not even have worked, but it was a sort of I think it was an example of beginning to get the hang of responding in the moment, but thinking more widely than the frame within which I'd learnt to do that kind of operation, because I'd learnt the specifics of surgery for that kind of procedure. I hadn't been taught about thinking sideways to completely unrelated ideas that might be useful later. And I think it's a characteristic of that stage of, as you get more.
Yeah, something like Edward de Bono would have, like, I guess, called lateral thinking. Thinking from
absolutely lateral thinking.
Yeah,
and I think there's something very interesting about.
And as you start to finish up,
when it does.
As you start to finish up the act about the journeyman, and you talk, actually, which is something I think is interesting, at a previous conversation for the podcast with Carl Benedict Frey from Oxford University, who does a lot of research around the future of work, saying that maybe 40% of jobs that exist just now are at risk from automation, from AI, robotics, machine learning, IoT, all those kind of things. And we were having a discussion about, well, which jobs, what kind of jobs, and it's interesting because his work linked a little bit to what you mentioned here about defining two different types of workmanship. So we're kind of talking about workmanship, but this is really any, I guess, craftsmanship, however you want to describe it as well. And it talks about the type of workmanship of certainty and a type of workmanship of risk. I would love if you just kind of like describe what the differences between those two things are, because I think it builds it can open us up as into thinking potentially where we're going to go in this fourth industrial revolution just now, and which jobs are going to be the ones that are perhaps going to be most valuable.
Yes, this comes from a very well-known furniture designer and writer who active in the 1960s, called David Pye, who talked about these two kinds of workmanship. The workmanship of certainty he describes as where all the creative work has already been done before the first thing is created. So you've produced a production line for making I don't know, chair legs or something like that, and then or teapots or something, and then every single one that comes off that production line is exactly the same. That's the workmanship of certainty. And against that, he puts the workmanship of risk. Now, he's not talking about risk in the sense of people getting hurt or bad work or anything like that. It's a different use of the word. But by workmanship of risk, he means work where the outcome is not wholly prescribed at the beginning. You never quite know how it's exactly how it's going to be, and that's stuff that's done by hand, or there are all kinds of examples of it. Um, but I think that it's a useful distinction because it points out that there are many areas of practice where things can't be guaranteed or precisely prescribed from the outset. Um, and some of them are things like musical performances, for example. And I think clinical practice is exactly like that. It's one where you are constantly having to manage and work with parts of the story that you can't completely control.
And it's almost like that idea of performance. I think of great salespeople, whether they're selling financial products or whatever the thing is they're selling. There's a difference between them, because they're going into it and they're reacting and they're improvising and they're doing all the
They're
things you
responding.
mentioned. They're
Yeah,
responding to the environment, and they're responding to and thinking maybe laterally, like you're talking about, as opposed to going on a website and saying, okay, I need this ISA or this financial product, whatever it is.
I think
It's
financial
routine.
advisors are a very good example. I think the really good financial advisors do something rather like really good GPs and really good bespoke tailors, where their starting point is is trying to work out where the person they with is coming from and who they are.
Mm.
And when I talk about this change a little bit earlier on in the pathway from being an apprentice, from learning to do stuff and thinking, and your primary focus being on showing people that you've learnt that stuff, or taken exams, or whatever, to becoming responsible for your own work and going out into the world in the journeyman phase, to use the old terminology. One of the crucial transitions I think you have to make is what the magicians I've worked with talk about. They say it's not about you, it's about them, and that's going back to the magic from the elbows
Yeah.
down business. Realizing that the whole purpose of your work is for somebody else. It's not just to show what you can do. It's about where it lands with your patient or your audience or your customer or your client, and that requires you to throw your attentional focus into a different place, to move it away from yourself and to recognize how it lands with somebody else and respond accordingly. And when I started thinking about the clinical consultation, for example, as a close-up live performance with a very small audience, I think doctors don't normally think of themselves as performers in quite that way, but once I thought about that, it made a lot of sense, because
Yeah.
then an encounter with a financial advisor is a close-up live performance with a very small audience, or indeed someone in a garage when you take your car and you want to know what's wrong, all those things. And that requires you, as somebody becoming expert, to listen and attend to how somebody else is responding,
Mm.
as well as just putting into effect the skills and the knowledge that you've spent a lot of time acquiring. And that's a difficult thing. And that as you get to the mastering stage, you are able, I think, to make sense of how you read your audience and then bring in these lateral things that we've just been talking about when we were talking about improvising.
And one of the things now, moving on this kind of final stage, the kind of mastery stage, um, you said, I mean, it's interesting. We were talking earlier about performance and the role of performance, and I think of myself as a keynote speaker, it's a type of performance. And we spoke about the difference between whether you're performing in front of an audience of, say, 500 people, as opposed to doing a virtual conference where you're in a small screen. You're using different body language, different facial, your eyes are doing different things, you're getting different responses. And so you're having to improvise, which is the thing we were speaking about there. It's not certain what the outcome will be. It's not a prescribed thing. But you kind of, as you were talking about it in this third stage, this mastery, you talked about this idea of thread management. And I thought this was very interesting, because I could see how this could apply to not just in the context of you were talking about it, how so many of us, if we're doing any type of performance, we can be learning from other crafts and other skill sets and other experts from completely unrelated fields, and use it to deepen our own work and maybe come up with some of those innovations. So first of all, can you describe what this thread management is? Because I just think this is a fascinating concept.
So thread management was an idea that was suggested to me. I've been working with the Art Workers Guild in London, which is an extraordinary organisation in central London, near Holborn, where people from many different kinds of expert crafts come together. And they invited me to show what surgeons do. So on one occasion I invited my colleagues. I do a lot of stuff with simulation, with presenting sort of representations of operations and things using models and artificial material, but real surgeons and anaesthetists and nurses to show how operations happen. And we were showing how a surgeon joins two pieces of intestine together with sutures, with threads. One of the art workers there, called Fleur Oakes, who's a very distinguished embroiderer, textile artist, said, when I watched that, I saw thread management. I have to teach my students about thread management, because otherwise they get their threads tangled up when I'm teaching them embroidery. I have to say to them, for instance, you mustn't have a piece of thread longer than the distance between your fingers and your elbow, because otherwise it'll get snarled up. Or if you're sewing round a corner, you have to untwist it every so often, otherwise it gets twisted around like an old-fashioned telephone wire. And so I thought this was a really interesting idea of thread management, because I'd thought about threads in surgery as just an incidental part, just how I joined bits of intestine together, and my focus was the intestine. For Fleur, her focus was the threads. So we organised a series of events which brought together people who used threads in different ways. So Fleur herself, a number of surgeons, we had some puppeteers who used threads with marionettes, had a fisherman, fly fisherman, who ties little threads and also casts using long threads. We had one of my colleagues who does computer modelling of threads in computer programs. Various people who use threads in different ways. Somebody who does knitting. And that led to two things really. The first was that I saw that there are different points of connection that lead to insights that you might not have thought of. So medical people usually connect up with other medical people in medical related fields or bits or areas of science that relate to medicine, I think. So the idea that you could see as your point of contact threads, and then the viewpoint of a surgeon and an embroiderer and a fisherman would be equally valid, if that makes sense.
Because you're experts. You're highly skilled at that thing.
Absolutely. I should have said all these people were very expert in what they did. So they'd all been through these stages, and they'd all become extremely skilled at what they did. And we discovered that when we tried to do what other people did. When I tried to cast a line or do a bit of embroidery, I discovered right away that I was not even at the beginning. And these people who made it look so effortless were very, very skilled. And that led, interestingly enough, to Fleur Oakes, who was sitting next to a consultant vascular surgeon dealing with blood vessel surgery called Colin Bicknell. It led to Fleur spending 2 years as the lacemaker in residence in the vascular surgery unit at St Mary's Hospital, part of Imperial College London, the university where I work. And that was a fascinating sort of residency, because there was Fleur and Colin both in the operating theatre, so they were both in the same place. Colin, like me, he's a consultant vascular surgeon, so he was thinking in terms of an individual patient and their anatomy and the disease and the procedure, all that kind of thing. Fleur, a fine artist who'd never been in a hospital, knew nothing about anatomy at that stage or disease or techniques, but what she saw was colours and consistencies and materiality, and she saw how people were working together in a close-knit group to do things that required dexterity and precision and care and response to one another. She saw all sorts of things that the surgically trained people had either never seen or had stopped noticing. And so it made me think that you can see different things. I mean, I know that sounds obvious, but it hadn't really struck me how different were the things that you could see in an environment that you can easily come to take for granted, that are important to notice, but that often escape attention. So when I was thinking about my later work as a GP, thinking about that in terms of performance was rather a similar thing. Instead of thinking about, the diagnosis of pneumonia or whatever, I was thinking more and more about how people who haven't met establish a connection that will allow them for the next 10 minutes to come up together with a joint idea of what the problem is.
Yeah, and I guess what you're also starting to go into, and you talk about towards the end of the book as well, is that classic kind of boundary crossers. They find people win Nobel Prizes, they have a core competence in one particular area, but they cross over. They've got a curiosity about another area, and they study this other area as almost as a side part of what they do, and then they bring in some of the learnings from that and apply it. So one of the ones you mentioned was Professor John Wickman and his team. And I thought what was interesting about that was because so much of we think about, let's say, creativity or innovation just being about the I or the individual or the ego. I thought what you described in John Wickman with the keyhole surgery was the role of the team and how the team worked together.
Yeah, absolutely. So John Wickham, who died 2 or 3 years ago at the age of 89, I think, was a pioneering figure in keyhole surgery, in the development of keyhole surgery, particularly around the 1980s. He was a urologist. He worked with people with kidney and bladder disease, and particularly focused on treating people with kidney stones. And he'd always had this idea. He said that, at that time, to take out a stone from the tube that goes from the kidney to the bladder, the ureter, you'd make a great big enormous incision the size of a runner bean, as he put it, in somebody's side to take out something that was the size of a lentil. And he'd always thought that this was crazy, but he didn't really know what to do about it. And then at that time, when he'd gone through the stages in the book, he'd become a master. He was an expert consultant urologist. Other things were happening at the same time. There were developments in technology. There was fiber optics beginning, imaging techniques, CT scans, new forms of ultrasound and X-ray. All sorts of things were happening, and a lot of technology developments around lenses and things. And so he brought together people from very different perspectives. He brought together instrument manufacturers. He worked with an interventional radiologist, an X-ray specialist, at a time when traditionally surgery was something led by the surgeon who told everyone what to do. And he completely challenged that way of thinking about things. He brought together people from all kinds of backgrounds to work together to try and address this problem of having to make large holes in people that took ages to get over, to do something that actually needed a tiny little bit of work at the end to fix the problem. And so he framed this in a way as a problem space, I think. Mm-hmm. And he invited different people to come and bring different solutions. And so the instrument manufacturer he worked with, Stuart Greengrass, for many, many years, was not medical at all, but was an expert in designing equipment and apparatus. And so they would work together to come up with ideas. They'd try them out, they'd see if they worked, they'd do them. And he'd gathered around him, John Wickham, a group of younger surgeons, and he would give them challenges. He'd say, look, come up with some new ideas by Monday next week. And then they'd all come together next Monday and they'd share these ideas. And they would try a lot of things which didn't work, but some of the things they tried did work. And that led to a radical change, the introduction of keyhole surgery, which is hard to think about now because it's so much part of what surgery routinely is these days, that it's easy to lose sight of how radical this was, and how radical not only in terms of technology but in terms of how people work together, and that invitation he gave to people to contribute from very different perspectives, which I think is a bit like Fleur Oakes, the lace maker, being in the vascular surgery unit and coming up with solutions to problems that the surgeons hadn't even seen as problems. And I think that's something that, we've seen it quite a bit recently, haven't we, with the early days of the COVID pandemic, with
CPAP,
working with racing car team, and with people from the world of textiles coming up with new technologies for making masks. We're seeing it all around, but I still think it's more unusual than routine. I think uh, I think there's a lot more that people can do in terms of thinking outwards and making connections
So
with.
that final stage, which is or whether that stage of the mastery, and we've been talking about changing direction and the role of the team and the people around you, and you kind of finish the book up with this idea of passing it on, um, and and so you said a number of different interesting things I thought, which I hadn't heard before. ZPD, I'd never
Oh
heard
yes,
this
there's
term
deputy. Yes.
before. So I'd love to know what ZPD and its role. And if someone has achieved a level of mastery and whatever their thing is, passing on to next year, and the idea of how ZPD and what how that refers to it. And then also this other idea, which I guess is kind of related, which is maps and guides, the difference between these two things. Because a lot of the things you see, if I'm sure probably lots of people have been learning how to make sourdough bread on over the pandemic, or play guitar and things. A lot of those are very tick box, the instructions of how to do things. And it's only much later when you kind of feel it and you're working with those materials, you start to develop the mastery, and you kind of move. So this between this idea of maps and guides. So please, first of all, tell me the role of passing it on, why that is important for mastery, and what is ZPD and how does that relate to
Okay,
it?
so I mean, I think the passing it on is, I talked about in the journeyman stage, when you have to change from thinking about it's all about you, to it's all about who you're doing it for, your patients or your customers, your audience. I think something similar happens when you at the mastery stage, where you again have to make a shift to thinking that your focus of attention is not just you, it's the people who are following you, and and not just how to make sure that they know what they need to know or can do what they need to do, but you also develop a sense of responsibility for guiding them into where they're going,
Hmm.
and to being aware of them as a person, and helping them not just in specific aspects of technical work or something, but making the right decisions about how they develop their own career, their own individuality. So this idea of the ZPD, it stands for Zone of Proximal Development, and it comes from a Russian psychologist called Lev Vygotsky, who was who was working in the Soviet Union in the 20s and 30s, but whose work became widely known in the West only decades later. But in a nutshell, there's stuff that you know how to do. There's a load of stuff that you just don't know how to do. But in the middle, there's stuff that you can do with somebody's help that you can't do on your own. And that's the zone of proximal development, as he calls it. And that's an area where where learning really happens. But it's an interesting area because it needs to be treated sensitively. If you imagine you're learning to do something you don't know how to do, you're learning to tie a bow tie or something like that. So first of all, you can't do it. Somebody shows you how to do it. You start to get the hang of it. You try it out. They correct you. They say no. Actually, it'll be easier if you turn this hand that way or something like that. But then they get to a point where you no longer want them breathing down your neck. You want to just be able to practice it in front of a mirror for a couple of hours yourself until you actually really get it. And so that is your zone of proximal development. And the role of a teacher then is to know, I think, how to get you to know the basics, but then when to back off, and then when to come back in again, and when to support you when you need it, and when to go away again, and when to have an overall view of what you're learning fits with where you started and where you want to go. And that idea of the zone of proximal development, I think, is a very helpful one, because it's a way of thinking about of joining somebody where they already are, rather than expecting them to know stuff that you know but they don't yet. And
Yeah.
and it fits into the maps and guides, I think, because sorry, did you want to?
No, I was just going to say. So there's not.
Because the idea.
We'll probably find out the Russians have a word for it now, but it's almost where like teacher, coach, mentor, advisor. It's like where some of these overlap. These a Venn diagram of these
I
things.
think I think all of these ideas come in, and the maps and guides idea. I was thinking about what is this process, and I started thinking about what is the difference between, um, you know, sat nav instructions that have a narrow focus, and they tell you what to do, and if you do it, you usually get to where you want to go, but you have no idea how you got there, and you've got no sense of the bigger picture of what's going on around you. Uh, if you're going on a cross-country walk, actually, what you really need is a map, so that you know what the terrain is like. But you need to be able to read that map, and you very often actually need you need somebody else. You need somebody else who's able to take you and help you deal with it when you can't see the landmarks because the fog comes down or something like that. But then there's also that bigger picture of deciding where you want to go in the first place. Do you want to go to the Cairngorms? Do you want to go to Dartmoor? You know, that whole question of deciding what the journey should be for you. And for that, you need somebody who's able to understand you, who might know things, that might be able to see things about you that you might not even have noticed. And that although you say you want to go to the Cairngorms, they might say, well, actually, for where you are at the moment, it might be actually better to go to Pembrokeshire or something like that. And that's a different thing. That's more like, I think, like being somewhere where we cross over between being a mentor and a coach, and someone whose primary focus is you and where you've got to on that path, and how they can help you navigate the next step, and very often be there to point out pitfalls and when there's a sheer drop on either side but you can't see it because it's foggy. You know, there's that aspect of it, but there's also the aspect of helping you work out where it is that you do want to go, and maybe suggest possibilities you hadn't thought of. And SatNav doesn't do that. And I think that that sort of rather restricted formal courses have there is a possibility of spending a lot of time learning stuff and finding out it's the wrong stuff.
And then I guess we come back around that virtuous loop again, because the master teaches, brings under the apprentice underneath her or him, and we move on.
That's what you hope, and so the world turns. And so I think one of the interesting things that came out to me from all the many experts I've talked to is when I asked them, you know, when they became expert, and most of them say, well, I haven't become expert. I mean, I don't think, and this idea that path, you can pretty much tell where it begins, although actually I think it begins a lot earlier. I mean, you were asking me about about learning to write, and of course I started learning to write when I was at primary school, you know, so it's something that's built up over many years. It's not something that I just started recently. But let's say you can pinpoint the beginning of the expert, but you really can't say where it ends. And several of them, Joshua the tailor said this, a wood engraver I spoke to said this. Joshua said, I know there's no such thing as a perfect suit, but I'll never stop trying to make one. The wood engraver I've worked with said there's no such thing as a perfect print, but I'll never stop trying to create one as well. They all give a sense that they know they are perhaps quite a way along a pathway, but they certainly haven't reached the end, partly because there isn't an end, and partly because it's a continual human process that, in a way, if it did have an end, it would be less attractive, because all of them feel that they are simply getting closer towards an unattainable goal, but that the process continues to be worthwhile.
Well, wonderful. I mean, this is such a fantastic book, Roger. Expert, Understanding the Path of Mastery. If people want to get their book, and also actually to learn more about you and your other writing, your other projects, and you do lecturing as well, where's the best place for them to go and find out about that?
Well, if the book is published by Penguin Viking, so if you go to the Penguin website, or indeed any bookseller, there's also an audio book version which I recorded myself, reading the book aloud over several days, and that's available too, again either through the Penguin website or through any good chain or indeed independent booksellers. If you're interested in the ideas behind the book, my own podcast series Countercurrent, I've recorded and released, I think, 135 quite long conversations with many of the people in the book, and lots of others besides. And so if you put in Countercurrent, all one word, and my surname Kneebone, Kneebone, into your search engine, that will come up with that. It's on iTunes and other areas free, but you just have to look up. And then if you put my name into your search engine, again, you'll find a lot of publications and things, particularly in journals like the Lancet medical journal, a couple in Nature, one of the scientific journals, and lots of other ones, exploring these ideas around crossing boundaries and what it is to become expert at it.
Well, Professor Roger Kneeburn, thank you so much for coming on the show today. I wish you all the best in your continued research and your continued writing and work as well. And I'm definitely, I think next suit I'm going to get made, I'm going to go to that tailor that you mentioned as well. So thank you, Roger, today.
Well, it's been a great pleasure to take part, and thank you so much for inviting me.
You can subscribe to the Super Creativity Podcast on Spotify, Apple Podcasts, or wherever you get your podcasts. While you're there, leave us a review. I really appreciate it. I'm James Taylor, and you've been listening to the Super Creativity Podcast.